Hello, everyone, and good afternoon from Dubai. I hope you are all safe and well. Before we begin, may I please check if my audio is clear or if you can hear me properly?
Yes, I can hear you.
Thank you. Thank you, Miss Mai. And yes, welcome to our 83rd live webinar. My name is Kriska, and I am delighted to be here with you today together with the TDCC training team. And we are grateful to have you joining us for another meaningful session. And today's topic is supporting children with autism, practical strategies for emotional regulation, learning, and inclusion. On behalf of TDCC, we would like to thank our 114 advocates from 12 countries who registered for this session. And to everyone joining us live here and on YouTube, thank you for taking the time to be with us today. And please allow me to acknowledge our registrants from Egypt, India, Kuwait, Lebanon, Oman, Pakistan, Philippines, Saudi Arabia, South Africa, Tunisia, United Kingdom, and UAE. So, wherever you are in the world, good morning, good afternoon, and good evening. And before we start, let me share a short video about TDCC and our esteemed speaker for today. Thank you.
Welcome to the TDCC Community Live webinar. TDCC stands for the Developing Child Center, located in Dubai and Abu Dhabi, UAE, established in 2012. We have been providing personalized support to over 1,000 children. We have over 80 dedicated and committed experts, and we work closely with parents and schools to ensure no child is left behind. We think different, we teach different. We empower, not limit children. Labels like autism, dyslexia and ADHD are not relevant or perceived as disabilities, difficulties or disorders that limit children's abilities. We believe that brilliance needs difference. The TDCC services are available in English, French and Arabic. The inclusive educational services nurture and support the developmental and educational needs and help empower each child to reach their full potential. Occupational therapy assists children in performing and achieving important learning and developmental skills they need in life. Psychomotor therapy is a healthcare profession that is based on a holistic view of the person and is involved in the treatment of different disorders. Speech and language therapy assists children who have disorders of speech, language, communication, and swallowing. Psychology provides both educational and clinical services, including counseling and parenting. ABA therapy focuses on improving specific behaviors. It is commonly practiced as a therapeutic intervention for individuals with autism. The specialist learning support. We assist in developing the academic and social development of students who need support in all these areas. BrainLinks at TDCC provides targeted brain-based programs designed to strengthen learning, regulation, and overall development through the Aerosmith program, the Neuralink process, and neurofeedback. And we design and host local and international training and workshops for practitioners, parents, caregivers, and educators. Just like this one today. We have a few rules to follow during the webinar. Please remain muted while the speaker is presenting. Please give your full attention to the presentation. We will be sending you the replay so you can review it anytime. Please be interactive if the speaker requests your participation. During the question and answer session, we kindly request everyone to type their questions in the chat box and the speaker will address them. Welcome to our 83rd live webinar, Supporting Children with Autism, Practical Strategies for Emotional Regulation, Learning, and Inclusion. We are honored to welcome Ada Muhammad Atown, educational psychologist, as the speaker for this webinar. With over 10 years of professional experience, Ada brings a strong and well-rounded background in supporting children, adolescents, and families across a wide range of emotional, behavioral, and developmental needs. She holds a Master of Science in Community Psychology and is currently a candidate for a Master of Science in Clinical Psychology, reflecting her continued commitment to advancing her expertise in the field. Her academic foundation is further strengthened by a Bachelor of Science in Psychology with a minor in Education. Ada has completed extensive training in psychological assessment and interpretation, with experience in a range of standardized tools used to evaluate children's cognitive, emotional, and behavioral functioning. Her professional development also includes applied behavioral analysis and psychological intervention and crisis support, enhancing her expertise in providing well-rounded, evidence-based care. Her areas of expertise include ADHD, autism spectrum disorder, special educational needs, parent counseling, and children and adolescent counseling. She is also a skilled training provider, equipping parents, teachers, and students with practical strategies to support academic, social, and emotional well-being. With her extensive experience and deep understanding of child development, emotional well-being, and evidence-based support, Ada brings valuable insight to this session on supporting children with autism through practical strategies for emotional regulation, learning, and inclusion. Ladies and gentlemen, let's all welcome Ada.
Hi, hello everyone. Good morning, good afternoon. Uh, I'm very happy to have you all here. I'm just going to share my screen with you. Just a second. Okay. Okay. Can you confirm if you can see my screen?
Yes, we can see your screen.
Yes, you can.
Okay, perfect. Okay, good afternoon, everybody. And as I said before, I'm happy to see you all here that you want to attend this webinar and learn more and get more experience out of it. My name is Ata Atoun. I'm an educational psychologist. I've been working in this field for many years so far. You might hear some voices around me, with online learning and everything and having kids at home, but it's okay. Um, Okay, let's start. Just let me check with my screen. It's working. Okay. Okay, so today I will be talking about supporting children with autism. I will be sharing practical strategies for emotional regulation, learning, and inclusion. The duration of this session is 60 minutes. So welcome everyone, and thank you for joining us again. As this is, part of our autism awareness series. This is our fourth session for this month. And today we'll be focusing on the practical strategies for emotional regulation and learning and inclusion. Okay, let us start. So what are you going to gain from this seminar or from this webinar, sorry, or what will you take away from it? Like develop a deeper understanding of autism from a practical applied perspective, learn evidence-informed strategies to support emotional regulation, explore structured approaches to enhance learning and independence, strengthen inclusive practices across school and home environment. Okay? Moving to the next one. So I want to talk here about the early support and how it changes everything and how it builds up everything. The early is always the better. So as we know, our statistics are showing, they highlight that 1 in 31 children is diagnosed with autism. And current prevalence highlight the increased need of awareness and capacity building. Early identification and intervention significantly improve long-term outcomes. Timely support enhances communication, emotional development, and independence. This statistic highlights why conversations like this are so important. And what we know from research is that the early and consistent support that we make, it will affect the child's life and the way they are developing and growing with autism. Autism is a spectrum. No two children are alike. What do I mean with this? One of the most important things to remember is that autism looks different in every child. We hear it a lot actually in schools from teachers, educators, and who we are meeting there. Sometimes we hear like, "Are you sure about the diagnosis? This child, he communicates well, he's socializing a little bit, he has good eye contact. I'm not sure about," or they tell us the opposite sometimes. But what I need you to understand that no children with autism are alike, and the way they are showing us their symptoms, or the way they are communicating or interfering with the word, it can be different from child to another. As you can see, I'm saying autism is a neurodevelopment condition. So meaning it affects how the brain processing the information. Children with autism may experience differences in social communication and interaction, and behavioral patterns and flexibility, and sensory processing. We need to understand that the way we look at them and the way we understand them, it should be individualized. It shouldn't be like a one size fits all approach. It doesn't work like that, because every child is unique by himself, and their needs, yani, every child has different needs from the other one. Okay. So this is why individualized support is very essential and important for children with autism. Seeing the word through a different lens builds better support. What do I mean with that? To effectively support children with autism, it is essential to understand their internal experience rather than focusing on the behavior or the observed behavior only. So children may experience sensory input like sounds to the light, to the touch, or more intensely, or become easily overwhelmed. Process language more slowly or needing additional time to yani interfering or talking or giving the information. Experience emotions deeply while finding it is difficult for them to express or regulate these feelings. Many behaviors we see are linked to how the child experiences the world. For example, a loud classroom maybe it will feel overwhelming, or for a child with autism, or a simple instruction may be difficult to process for them. When we understand this, we respond with empathy rather than frustration or our expecting specific actions from them. When we shift from managing the behavior to understand what is the underlying needs, we respond more effectively, and we use supportive, individualized strategies that promote emotional regulation, communication, and engagement, which will help the child to develop and nourish more. So let's start. Part one, I want to talk more about emotional regulation. We will start with this because this is the foundation. I believe, and also studies shows, if the child is not regulated, they cannot learn or communicate or engage effectively. Maybe they can get here and there like few things, but it's not going to be effective as it's supposed to be. So when they are regulated and ready, are going to be more engaged with the learning. Emotional dysregulation has neurological roots, not behavioral defiance. Sometimes people judge children with autism when they see the way they are behaving or when they are having meltdowns, or yani, the behavior is not how it is expected. But what we need to understand that they are not defying us. There is a root behind this behavior. There is a trigger that made this behavior come to the surface. So, emotional dysregulation in children with autism is not a matter of choice or defiance, but reflects underlying neurodevelopmental differences. It is often associated with atypical processing of stress and sensory input, leading to heightened reactivity, limited internal coping and self regulation strategies, difficulties in identifying, understanding, and communicating with emotions. I want to give you an example. But before, I want to mention something small. It is important to shift our mindset, by the way, because when a child is having a meltdown, they are not being difficult. They are not being defying. They are overwhelmed. Their brain is struggling to process and cope at the moment, and they are not. They still don't have the best skills or practices to show their emotions in the right way. For example, if we're talking about a 6 years old child begins screaming and crying when entering a noisy classroom, this is not refusal. this is a sensory overload. So the teacher or the LSA or whoever is helping the child should reduce the noise and help them, like prepare the child before ahead. Like, we are entering this class, you might hear many noises and you might see many students or kids around you. This will help the child to regulate and to know what is expected from them. Behaviors perceived as challenging are frequently indicators of emotional overwhelm, whether the child lacks the necessary skills and supports to regulate them effectively. Color coded emotion zones give children a shared language for feelings. I love color coded emotion zones. This framework gives the children a simple way to understand their emotions. It helps them to shift from good or bad behavior to the zone that what am I in, and what do I need to do, or what do I need in general. The zones of regulation framework offers a structured, developmentally appropriate approach to supporting children's emotional awareness and self-regulation. It helps them to recognize and differentiate their emotional and physiological states, accurately label and describe their feelings, understand that all emotions are valid, while learning that not all behaviors are appropriate. By providing a consistent and visual language, the framework enhances communication between children and adults, enabling more proactive, calm, and effective response to emotional needs. So I feel when we teach them this on when we have the color coded emotional zones, the children will learn best how to recognize and differentiate these emotions and how to deal with them, like how to show them in the appropriate way. And they will understand that our emotions are valid, their emotions are valid, but there is something, not all behaviors are appropriate, but all emotions are allowed and valid. Moving to the next slide. 7 evidence-based strategies that build emotional regulation skills. By the way, by the end of the webinar, I will be sharing this with you and you will have references. So if you want to read more or like research more, you will have references that you can go and check. I like these 7 evidences based. So let's read them together. Establishing predictable routines to reduce uncertainty. This is something works very well with children with autism and other children as well, because when the child knows what is happening next and or what is expecting from them, they work better, they do better, they feel relieved, and they can do better. Using visual support to increase understanding. Visual supports are amazing because they are having things in front of them. And usually, as we know by studies, that children with autism, they have good memory and they learn by visual aids better, and they can notice all the details, and they have good memory. So using these visual aids, it will help them and it will increase their understanding. Providing sensory tools to support regulation. Um, Lately, we've been hearing like many children are holding fidgets, but in this case, sensory tools are a tool. It's not like an extra thing they can play with or they just reflect their feelings on. No, it's a tool that they need and it will help them. Teaching calming strategies explicitly rather than expecting them to develop it naturally, which makes sense. This is something we need to teach them. We are not expecting them to have this skill specifically by themselves. This is something we need to role model as educators and psychologists and teachers in front of them. This is something they need to see it from that they need to see that we are doing this so they can learn it and develop it by themselves. We should not expect that they should have it. Like, it can be, and it can be not most of the time. So this is something we need to focus on. Modeling calm behaviors as adults, which I mentioned right now. Uh, Modeling with children in general is amazing because we are teaching the skill in a non-direct way. So if I'm acting calm and I'm showing the kid or the child that I'm dealing with my emotions calmly and I can express them in a calm way and I can show what do I need, I think they are also going to absorb this and do it as well. Anticipating triggers and planning ahead, which works very well with children with autism. If you know what triggers the child, it is very good to avoid it in order not to have a meltdown or not to have a severe behavior that is unwanted or unnecessary at that moment. Reinforcing attempts at self-regulation. Reinforcement is amazing as well, and whenever they are attempting to regulate themselves, reinforce it and encourage them to do and to continue this behavior. These strategies aim to build skills over time, not just manage behavior in a moment, and do not expect to have them all together at the same time, or do not expect that the child he might have some of them, but these things you need to build it over time and work on it over time. Children cannot self-regulate until they have first been co-regulated, which is amazing. Children cannot calm themselves if no one has shown them how to do it. They borrow our calm. They see how we are reacting with things and they borrow it from us. So, in moments of distress, our role is not to correct, it is to regulate alongside with them. A child, let's say a child throws an object during a meltdown, instead of saying, "Stop, don't do this, no, bring it down," you should show a lower voice, reduce the demand, offer reassurance, and help them. And the outcome, you will see it with the child. He will gradually calms down because the adult is regulated as well. And what I said here, self-regulations develops within the context of supportive relationships, and it is not an innate skill. Co-regulation refers to the process by which a calm, responsive adult provides external support to help a child manage their emotions and behavior. This includes creating a sense of safety and emotional security by showing the child that you are safe and you are emotionally secured around us. Reducing emotional intensity through a calm and attuned response. Our responses should always be calm. We should watch our tune when we are talking with them. Supporting the child in understanding and labeling their feelings. Child may not know what they are feeling or how to say what's the right feeling that they are going through now. So it is good to tell them or to focus on giving them the names. You are feeling anxious. Are you anxious? Are you upset? Are you distressed? Are you happy? Give them the names so they can learn it and later on they can say it and label it. Through repeated co-regulation experiences, these external supports are gradually internalized, enabling the child to develop independent self-regulation and adaptive coping skills over time. So this will happen over time, and the more the more you repeat it, the more they will learn it and get the experience and the skill from us. Part 2, we'll talk about learning supports and structured teaching. Okay, strength-based teaching for learners with autism spectrum disorder. Many children with autism are strong visual learners. When they rely on when we rely on verbal instructions, we are not teaching in a way that matches how they learn best. So learners with autism often demonstrate cognitive strength in areas such as visual processing, strong memory, and attention to detail. These strength points can support learning when instruction is presented in structured, visual, and explicit ways. At the same time, they may experience challenges with cognitive flexibility. It can be a challenge for them adapting to change or new ways of thinking, transitions between the task, the assignments, or the activity. It can be also a bit hard for them to do the transition. Understanding abstract or non-literal concepts. Also, this can be a challenge for them. Affecting, as I feel like effective teaching adopts a strength-based approach. And these cognitive assess while providing structured support, predictability, and scaffolding in areas of difficulty. So if I know the child has difficulty in a specific area like the processing speed, or let's talk about this process speed, for example, we need to provide the structured support. Like we can extend the timing, we can give visual aids that help him to get the information and process it more quickly. and make the task more predictable for them, so it can be easier for them to know what's expected from them next, so they can work on it and finalize it. Structured teaching reduces anxiety and maximizes independent learning. Do you think having a routine, if you, I'm not sure if you can open your microphones, but you can write me in the chat. Do you think having like a routine will help them more, or it will be like overwhelming with children with autism, for children with autism? What do you think? I'm trying to read. Okay. Okay. I want to say, I will explain more about this and talk about it. I feel having a routine for children in general, it is a good thing because it will reduce their anxiety, because they don't have uncertainty. They are knowing, or they know what is going to happen next, or what is expecting from them next. And this will help them to be more independent. If I'm a child, or if I have a child that he has a task to do, and I'm explaining the 5 first minutes you need to do this, the next minutes you need to do this. So, and he has something that reminds him what is expected from them, or what will happen next, or how to complete it by themselves. This is also will make them more independent and more confident to do things alone or by themselves, which is something we want them to gain. We want them to have this confidence. We want them to be independent. So I'm saying here, structured teaching provide clarity and predictability, which are essential for many learners with autism. When children know what is expected from them, when it will happen, and how to complete the task, they experience reduced anxiety and increased independence. Structure is not restriction. It is support for success. I'll give you a scenario as well. If we had a child that refuses to start the work, after introducing a visual schedule, the child begins completing tasks independently. We can have like a visual schedule on their desk, or at home or in school, telling them what is expected, what do you have to do now, what do you have to do next, and how to do it independently. This will help them. And my main message out of this is clarity reduces resistance. Visual supports reduce anxiety, build independence, and support all learners. Visual supports provides a structured and accessible means of presenting information, making expectations clear and more concentrate for learners. Examples: visual schedules, step-by-step, task breakdowns, first, then boards. There is so many visual aids you can look for. These are the main ones that I wrote here. But I feel having a visual schedule with the child that you are working with is very important. And you can tell that the child, some schools I see them, they are putting it on their lanyards with a small schedule, like telling them like what are the skills that they are working on this day, what is expected from them, and what do they have to do. Maybe you can have this. You can do the step by step by breaking down the tasks or the assignment, so they can understand it and process it in the right time that they need. And first, then boards. These are some kind of boards or cards that you can have them in front of them. First, you know you need to do this, and you write or you put picture for what is expected from them to do, and then the other action that you are expecting them to do as well. These supports reduce reliance on verbal processing. So if the child that I'm dealing with is not confident verbally, this will reduce the verbal processing or the verbal expectations, or they will not feel overwhelmed that they have to express it or say it, or they need to work on it verbally. And it enhances predictability. It also enables the child to navigate the task and their environment with greater independence and confidence. Okay. Let's talk about ABA therapy. Now, we have mentioned that in TDCC we do ABA therapy. We provide this therapy for children with autism and other children as well. So it stands for Applied Behavior Analysis. It's an evidence-based approach that focuses on understanding and improving behavior by teaching new skills and reinforcing positive behaviors. It works by breaking skills into small teachable steps, using positive reinforcement to encourage the learning, and monitoring the progress to guide intervention. Also, after each intervention, the ABA therapist and the parents, they do a feedback session together to make sure that what they are applying is working. If not, they reflect on the action plans or the methods that they are using and they change it. ABA is commonly used to support children with autism in general and other children who are dealing with issues with communication, social skills, and daily living skills. Also for autism kids who they are dealing with communication, social, and daily living skills. When ABA is applied appropriately, it focuses on teaching skills step by step and reinforcing the progress. So whenever the child taking the first step, doing it correctly, we do the reinforcement. So we maintain the progress and the positive behavior. It should always be individualized and respectful for the child's need. So I cannot take an ABA therapy plan for another child with autism, even from the same level of autism, and apply it on another one, because it should be individualized. It should serve the needs of the child that you are working with. Some of the skills are generalized. It can be used, but still we need to respect the child needs, and we need to know that the child we are working with, what are the goals that we are working on, what we are aiming from this ABA therapy, and what we are looking for. Okay? Inclusive classroom practices make a measurable difference. One second, I need to fix something. Sorry, I had to put my charger. Now I think all is good. You can hear me, right? Okay. Inclusive classroom practices make a measurable difference. I feel in UAE now we are adapting this. Like we are adopting all inclusive classrooms, and we are having more inclusion departments focusing on the children and their needs and what is expected from these children, and they do individualized IEPs for these children. Okay. So inclusive classroom are intentionally designed to support and diverse learners it includes clear and consistent instructions, structured routines, sensory accommodations, flexible teaching approaches, opportunities for success, and positive reinforcement. These strategies benefit not only children with autism, but all the learners in the classroom. And I can see this happening a lot in UAE schools, which is helping a lot of children with learning difficulties or any other difficulties. And we can see that they are now accommodating the curriculum for the children in UAE schools, especially in Dubai, like let me say, and Abu Dhabi, I guess. So now the curriculum is differentiated in a way that it serves the needs of the child, whether he has autism or any other difficulty. And inclusion is not about doing more. It is about doing things differently or doing things in the way that is suitable for that child, and it helps him to learn and continue with his learning journey. Sometimes small adjustment in teaching can make a significant difference in his learning and in his life. Inclusive classrooms are intentionally designed to accommodate diverse learning profiles, ensuring equitable access, participation, and engagement from all the students, including those with autism. And effective practices include, what does it include? Clear and consistent instructions, reduces cognitive and cognitive load, and support comprehension, particularly for learners who require predictability. Structured routines when they have it in the class. Also, it provides sense of safety for all the children. Sensory accommodation, which is are like adjustments for the kids, for the children, like reduced noises, flexible seating, maybe the speakers they can put on their ears to mute or reduce the noises from around them. It helps the children to regulate and to regulate sensory input and maintain engagement. Also, inclusion classes should be flexible teaching approaches. As I said before, differentiation is the key. And when we have differentiated curriculum, we allow content to be presented in multiple ways to all the children, and it can meet many different needs in the same classroom. Opportunities for success and positive reinforcements. This will build confidence and it will motivate the children and reinforce them to participate and show the desired behaviors. These approaches reflects universal design principles benefiting not only students with additional needs but enhancing learning outcome in general in the whole school or in the whole classroom. Okay, moving to the next part. This is part 3, when we are going to talk about inclusion in school and community. Okay, inclusion is not placement, it is belonging, participation, and contribution. True inclusion for children with autism goes beyond physical placement in the classroom and focuses on the quality of their experience. So we're not talking about, okay, this school, it has an inclusion department. We accept students from different backgrounds. We accept students with different diagnoses, let's say learning difficulties, ADHD, autism. But what do we do for them? We just offer them classes. They sit and they watch or they listen to the teacher, and that's it. We cannot consider this an inclusion environment. This is just placing the students or the children without offering them anything, without working on their needs, or without offering strategies or um, strategies or methods to develop their skills and work on it. True inclusion for children with autism, it goes beyond only like placing them in classes and having them in classrooms. The environment should feel safe and accepted, and within predictable understanding environment that respects their needs. So as I said, it's not about just putting them in the class and like leaving them alone or having them with a teacher who cannot interact with them or doesn't know what to do or what to offer them exactly. That will not help the child to feel safe. It might actually do the opposite. It might trigger them or make them feel that I'm not wanted here or I'm ignored. No one is interfering or no one is communicating with me. So they might show unwanted behaviors. And it also should be actively engaged through adopted accessible learning that matches their profile. So that child is sitting in the class, but he is engaging with the learning. He is learning, he's getting something. He's not just a listener. Has opportunities to contribute using their strengths in meaningful and valued ways. And what do I mean with this one? If like we need to help them to contribute, to participate in a way that is suitable for them, that will not pressure them, and having them active. If I know my child strength points, like he's a visual learner, maybe I can help him to participate in class by using visual answers or like writing them or drawing them or doing anything best to feel that he is there and he is participating and contributing with this learning. In this context, inclusion is defined by participation, engagement, and sense of belonging, not simply by being present in the same space or in the same class. Because a child can be physically present there but feels excluded or like ignored, as I said before. True inclusion means the child feels safe, valued, and able to participate in the class with his classmates and the teacher. Environmental design is the first intervention. So what do I mean with environmental design? Before implementing targeted strategies, it is essential to ensure that the learning environment is appropriate and ready to adapt to meet the needs of children with autism. From an educational psychologist perspective, environmental modification plays a preventative role, and it helps to support a child to regulate their feelings and emotion. This includes, for example, like minimizing sensory overload, like minimizing the visuals in the classroom, minimizing the noises, and minimizing the crowd. If the class has 32 children in it, this can also be overwhelming for children with autism. Establishing structured and predictable routines for the children with autism in the class, and incorporating clear visual supports to enhance understanding. A well-designed environment reduces cognitive and emotional demands, enabling the child to engage more effectively in learning and decreasing the likelihood of dysregulation or behavior challenges. Before implementing these, the environment must support the child by considering, as we said, reducing the sensory overload. I know recently all the classes they have the decorations and the students' work, but as I said before, if we cannot remove this, maybe we can place the child in the right place in order not to have all these decoration, let's say, around him, that it might overload his sensory. And creating structured, predictable spaces as well, providing visual clarity. A well-designed environment prevents many challenges before they arise, which, as I said before, uh, every behavior that might happen, there is a trigger that this triggered this behavior to happen. So when we have this, it's a preventative method that we can use that will help the children with autism and other children as well. Structured peer support builds meaningful social inclusion. So we got the children, we included them in classrooms. They are there, but they are not socializing, or they are not having this experience of like talking to peer, having support from them. No one is communicating with them. This is also something we need to work on. Children learn a lot from each other, by the way. Structured peer interaction can build confidence and social skills in a very natural way. But also, we need to keep in mind the child that I'm working with and his needs. Some of them, they do not like to socialize. And some of them, they don't know how to ask for it. Like they want to have friends, they want to communicate, but they don't have the skills. And this is what we are targeting now. And as I said, when they have peers, they learn from each other, and this can happen naturally without having a plan or an IEP for it. They get skills from each other. So peer support programs can model appropriate interactions, provide guided opportunities for connection, build empathy and understanding among peers. It is very important when we place a child with autism, or any like from the inclusion department, any child, we need to make sure that this classroom is prepared to have children from different backgrounds. We don't need any bullying to happen to them and that can make things worse. Sorry. So we need to prepare them, maybe by talking to them, maybe by involving the teachers, the educators, school counselors, principals, to make sure that this class is ready to have a child with autism, so they can support him and peer we can, for example, buddy him up with someone who is suitable, like they can click together, or they can relate to each other, and someone with empathy that can help. I will give a case scenario. If a child struggles socially after introducing a buddy system, this can help him to begin engaging during group work. We cannot force the children to be friends with each other, or we cannot force a child that I'm working with, okay, you're going to be with this child the whole day. No, it doesn't work like that. It should happen step by step. He should be introduced. You should talk with your child about that this is going to happen. I'm going to introduce you to someone. You're going to have classmates. They are helpful. They want to help you. They can help you in the classroom with the learning, with anything else. So, and I believe that everyone, yani, you know your child better than everything, than anyone else. So you know how to approach them and how to prepare them for being in classes. Sorry. Okay, let's move to the next slide. Every child has something to say. Our job is to find their voices. Communication is not limited to speech, and it's not about like talking. That's it. Every child communicates in their own way, even if it's not through words. Our role is to recognize and support their way of expressing themselves and to help them to find this voice and to start using it more and more. Communication for children with autism is not limited to speech. Many children express themselves by different ways, such as through gestures, visual, or assistive communication tools. It is important to assume that every child has something to communicate and wants to communicate. This is a good, yani, something to assume. When we provide the right support, children can better, yani, can do better, and they can express their needs in a better way, and they can express also their feels and their thoughts. By recognizing and supporting all forms of your communication, we reduce frustration and help children engage more confidently with others and their environment. Children may communicate maybe through many things, not only the three ones that I have mentioned here. Um, they can draw, they can interact, they can do gestures, they can use technology nowadays to express themselves. Our role is to presume competence and provide the tools needed for expression. So we want to find this voice and help them also to find it and express themselves. And by the way, like once the child knows how to communicate or to how to express himself or herself, you can see that his emotion side is getting better or more regulated, because many issues or many problems or unwanted behaviors, they come because the child couldn't find the right way to express or couldn't find the right way to communicate or tell or express his needs. So he used other methods, that like by hitting or grabbing or doing things that not wanted. But this is our job now. This is what we will do, and this is how you will help them, inshallah, to find this voice. Sensory accommodations are tools. Many teachers now in school, I feel they believe sensory, like fidgets, slime, and these stuff are like things students bring to play with. And they don't believe that it works. But now we are spreading the awareness also that these are tools. Kids or children with autism, they need it. It helps them. Sensory differences can significantly impact learning and behavior, providing accommodations such as also movement breaks, noise reduction, sensory tools that I was mentioning before now. Allow children to access learning more effectively. So if we are providing these breaks, children are having the rest so they can go back to the learning in a very effective way. They can join back refreshed. Now they feel more ready. It helps a lot. You can search more. I will, inshallah, if you communicate with me by my email or later by my Instagram, I will add more tools and things that you can use and equip, your child with. And I need you to remember something very important, that sensory tools are not rewards. They are there for the children with autism to support them. We are not rewarding them, we are supporting them. They allow them to access learning just like glasses, how it helps a child who doesn't see very well to access the learning. Okay, part 4, and I think this is the final part. We're going to talk about supporting families and caregivers. How can we do this and how can we help them? Family professional collaboration produces the best outcomes. What do I mean with this? Children with autism, they will benefit a lot from a consistent collaboration and approaches across home and school. If visual schedule is used at school, using a similar structure at home will help a lot. It will help the child to understand the expectations and the transitions more easily. When both parents and teachers use the same language for emotions or behavior, it strengthens the child to understand the environment and what is expected from him. Consistent behavior support strategies like positive reinforcement, clear instructions across setting increase the likelihood of skill development. Regular communications, it should be happening between the educators and the house, which ensures that both sides can share updates and adjust strategies as needed and reflect on the action plans and the IEPs. And also, from my perspective, this collaboration supports continuity of care, enhances skills generalization, and ensures that interventions are meaningful, consistent, and are effective and happening in the right place. And I wrote these three like the main ideas: consistency in routines and expectations across all the settings. This is important and needed. Open and ongoing communication, as I said, between family and school, it should be happening regularly. They should be like reflecting on what they are doing and what is going good and what needs to be like improved or to be changed. Shared understanding and use of strategies to support learning and regulations. Families play a central role as partners, and collaboration ensures that support is cohesive, effective, and responsive to the child's needs. So, this is important as a parent. Your role is very important in your child's life, and it can help him to change a lot and it can add a lot to him. High impact home strategies. I wrote some of them. Maintaining routines, it will help. These are simple but important. Using visual supports, practicing co-regulation that I have explained before, reinforcing positive behaviors, creating a calm and structured environment. Maintaining routines is very important by keeping the daily activities happening at the same time, like bedtime, meals, homework. It's good to have them happening at the same time each day. This will help to reduce the anxiety and support the transition. And using visual support, as I explained before, it's also helpful. Practicing regulation, support the child during moments of distress by staying calm and use your soothing tone with them to help them calm and guide them the through the experience. And also reinforcing is amazing because when you reinforce the behavior, you make it you are like reassuring the child this is the right behavior and you want it to continue and you wanted it to keep happening. Okay. And also creating a calm environment for them will help a lot. Minimize the noise, reduce the clutter, provide predictable spaces where the child can feel safe and focused on himself and what is happening around him. And this will help him, by the way, to build independence. Community support also is essential. Community support plays a critical role in supporting children with autism spectrum because it will help the parents to access different forms of support, which can make significant difference. Like professional services working with specialists like psychologists, speech and language therapists, occupational therapists, which provides targeted intervention for them. By example, like improving communication skills, sensory regulation, or behavior support plans, support networks, connecting with other parents and caregivers or groups, offering emotional reassurance, shares experience. It's good for parents like to communicate in such groups because you can share experiences with each others. Like you can tell what is going well with you. Other parents might try it and feel like it's happening, it's going well with them. It's good to have these groups actually. Community resources, access to inclusive activities, therapy centers, workshops, and school-based programs. It helps the children build skills in real life settings, social skills, group to be in groups, inclusive sports, community events. This is all helpful, and families often face ongoing emotion, like families with children with autism. I know they face ongoing emotional, practical, and decision-making demands all the time, and they have all the rights to have the access to all these stuff and to get these professional services from the community and from us as well. Okay. We have 6 principles that should guide every interactions. Behavior is a communication. Remember, whether it's an acceptable or like an acceptable behavior or not an acceptable behavior, it's a way of your communication that child is trying to communicate. Regulation comes before learning. As I said, if the child is not emotionally ready, not regulated, not happy, not feeling themselves, I don't think they will be fully engaged with the learning. Predictability supports success. This is what I've been like talking and explaining. If the child knows what is happening next or what is expected from them next, it will help them to do better, and it will help them to be more independent and do their work in a successful way. Strength-based approaches are essential as well. Remember, every child is unique, definitely. Relationships are the foundation. Build a positive relationship with your child, build it with their educator, LSAs, or even if you are an LSA or a teacher here that you are with us in this webinar, also work on your relationship with this child and do not ignore them. Do not like consider them like an extra child in the class that you need to offer extra work, extra worksheet and everything. Remember, it is important. They have feelings, they know what is going on around them, and it is the foundation. And there is nothing to remember. Remember the most important thing, and I want you to remember always: communication is behavior. Like, behavior is communication. So whatever is happening, try to look what is behind this behavior. What are they trying to tell you, or what do they need? Effective change starts with one small action. Meaningful change does not require perfection. Start with one strategy. If you are new or an expert, always start with one strategy and then apply more and add on it. Apply it consistently. Reflect on its impact. If you tried a method or a strategy, it did not work, then you should stop it and look for something else. Build gradually. Small intentional actions lead to lasting change. Do not try to change everything at once. Choose one strategy, one behavior you want to work on, apply it consistently with the strategy that you are doing. That is how meaningful change happens. That's all. If you have any questions, you can write them in the chat. I'm happy to answer your questions. And thank you for your continued commitment for supporting every child's potential. This is my email, keep it, and this is my Instagram if you want to add me. And now I will be taking your questions. If you have any questions, please share with me. Welcome. I read that you are telling me thank you for the meaningful and helpful things. Welcome. You are more than welcome. How to communicate with parent who expects a quick fix? This is a very good question, actually. I feel you need to be very clear from the beginning with the parents. I know sometimes I am a parent as well, and we expect things to happen quickly. But when you are, from the moment you start working with this child, share the IEPs with the parents, share the expectations, and share what are your goals. And when you write the IEP on where you prepare it, you have the timings, right? So the parent needs to understand that this does not happen in a week or a month, and it can be different from child to another. Always explain how long you expect this behavior to, and how long you expect the skills to be gained, or when he will learn it, and be what they say it. I cannot recall the word. Be very clear and be very honest with them. Okay. What else? Um, checking if there is more questions. What are effective ways? Sorry, let me make it bigger. What are effective ways to help a student regulate her emotions in the moment when she feels overwhelmed or frustrated? First of all, we need to understand like why is she feeling that way. If we are talking about an autistic girl, we need to understand what brought her to that place, like what made her feel overwhelmed. You need to understand the trigger behind this behavior. It doesn't have to be at the same time or at the same moment, but try to look around you to understand what is happening. There is many things you can use to help her regulate. You can talk to her in a very smooth, nice tone, just to calm her down. You can do like breathing technique with her, like it depends also how old is she. Like breathe, take a deep breath. Imagine yourself smelling a rose, blowing a candle until it helps her to regulate a little bit. And also, the most important thing actually to know what made her feel upset. Help her to communicate with you. If she's not someone who's talking, give her a paper. Maybe she can draw what is overwhelming her, or she can journal. If she's big, she can write. So you can understand what's happening. Like you get more what is happening with her. Parents, okay.
Okay, I think after that should be our last question. And
Yeah,
if, of course, if they have additional questions, if you would like to reach out to Ata, this is her contact details,
yeah.
and you can
Actually, I
definitely
don't
reach
see
out.
more questions. I'm looking, but nothing there. I'm afraid I don't want to miss any, but I don't see anything.
Of course, but definitely they can reach out to us as well, to
Yes,
TDCC training team,
definitely.
and rest assured we will be sending out the video, this video,
Yes,
the recordings to all the attendees today. Okay.
yeah.
And of course, thank you again, Atta, for the very
Welcome.
informative
Thank you all
session.
for joining. It was a pleasure, actually. And I
Yeah.
hope you really, it was like helpful, all these strategies and things that I have shared with you. And if you need anything, as I said, you can communicate with us on TDCC, or you can add my Instagram. You can communicate with us there as well.
Yes. And of course, thank you everyone for joining us
Thank
here
you.
today and on our YouTube Live. We will be sending, of course, our replay, and please stay tuned for the TDCC announcement, including the next webinar schedule that we have. Thank you so much and have a
Thank
lovely
you.
weekend, everyone.
Bye. You too.
Bye.
Bye. See you.
See you.
Thank you once again for joining us today. Before we conclude, we would also like to take a moment to share some of the services, programs, and upcoming initiatives available at the Developing Child Center. Upcoming webinar series. As part of our continued commitment to raising awareness, promoting education, supporting child development, and empowering families, TDCC continues to present insightful webinar topics led by expert speakers and practitioners. These sessions are open to parents, teachers, and advocates around the world. Our core educational programs. Beyond our webinars, TDCC also offers a range of educational and therapeutic programs designed to meet the unique needs of every child. Early Intervention Program. Our Early Intervention Program in Abu Dhabi supports young children in building essential developmental, communication, social, and learning skills during the most important early years of growth. Intensive Educational Program in Dubai. Our intensive educational program provides structured and individualized support for children who need focused intervention to strengthen their learning, behavior, and school readiness skills. The program offers Early Intervention Program, School Readiness Program, and Life Skills Program guided by our multidisciplinary team. Psychology and Family Support Services. At TDCC, we also understand the importance of emotional well-being, behavior, and family guidance in a child's overall development. Psychology Services. Our psychology services help children and families better understand emotions, behavior, development, and mental well-being through professional guidance and support. Educational Psychology. Our educational psychology services help identify learning needs, cognitive strengths, and challenges so children can be better supported in school and beyond. Parenting services. Through our parenting services, we empower families with practical strategies, guidance, and support to help them confidently navigate their child's developmental journey. Counseling for children, teens, and adults. We also offer counseling for children, teens, and adults, providing a safe and supportive space to work through emotional, behavioral, social, and life challenges at every stage. Social, emotional, and behavioral assessments. Our social, emotional, and behavioral assessments help identify the emotional and behavioral factors affecting a child's daily functioning, relationships, and success at home or in school. Comprehensive assessments. To better understand each child's individual needs, TDCC also offers a range of specialized assessments. Multidisciplinary assessments. Our multidisciplinary assessments bring together different specialists to provide a holistic understanding of a child's strengths, needs, and developmental profile. Developmental assessments. Our developmental assessments help identify a child's progress across key areas such as communication, motor skills, social skills, and learning. Dyslexia assessment. This assessment helps identify signs of dyslexia and provides valuable insight into a child's reading, spelling, and language-based learning needs. Speech and language therapy assessment. Our speech and language therapy assessment looks at a child's communication abilities, including understanding, speaking, listening, social communication, and speech clarity. Occupational therapy assessments. Our occupational therapy assessments help identify challenges related to sensory processing, motor skills, attention, coordination, and everyday independence. Sleep assessment and intervention program. This program helps identify sleep-related challenges and provides practical strategies to support healthier sleep routines and better daily functioning. Psychomotor therapy. Psychomotor therapy supports the connection between movement, emotions, behavior, and learning. Through guided activities, it helps children strengthen body awareness, coordination, emotional regulation, confidence, and overall participation in everyday life. Speech, language, and communication support. Communication plays a vital role in every child's confidence, learning, and connection with others. That is why TDCC offers a range of services to support speech, language, and communication development. Speech and language therapy. Our speech and language therapy services support children in developing communication, understanding, expression, articulation, and social interaction skills. Feeding therapy. Our feeding therapy supports children who experience difficulties with chewing, swallowing, food acceptance, or mealtime routines in a supportive and gradual way. Play therapy. Through play therapy, children are supported in expressing feelings, processing experiences, and developing emotional regulation through the natural language of play. Occupational therapy and daily living support. TDCC also provides occupational therapy and daily living support to help children become more confident, regulated, and independent. Occupational therapy. Our occupational therapy services help children improve the skills they need for daily life, including play, learning, motor coordination, attention, and independence. Sensory integration therapy. Through sensory integration therapy, children who have difficulties processing sensory information can become more regulated, focused, and comfortable in everyday settings. Handwriting program. Our handwriting program helps children strengthen the fine motor, visual motor, and coordination skills needed for clearer and more confident writing. Toilet training program. Our toilet training program provides structured support to help children build readiness, confidence, and independence in toilet training. Listening therapy. Our listening therapy is designed to support attention, auditory processing, communication, and learning through targeted listening-based intervention. Tinnitus therapy. We also offer tinnitus therapy, a sound-based intervention that supports listening, attention, language, emotional regulation, and overall brain development. Specialized therapeutic interventions. For children who may benefit from more targeted intervention, TDCC also offers a number of specialized therapeutic services. Neurofeedback therapy. Our neurofeedback therapy helps train the brain toward healthier patterns that can support attention, regulation, emotional balance, and overall functioning. Neurolink process therapy. Our Neurolink process therapy supports brain-body connections that can positively influence regulation, learning, attention, and emotional development. ABA therapy. Our ABA therapy uses evidence-based strategies to support communication, learning, behavior, social skills, and everyday independence. The Aerosmith Program. An evidence-based cognitive training program that strengthens the brain's learning functions to create lasting change. It is done online and available for children, teens, and adults. Educational therapy. Our educational therapy provides individualized support for children who need help with learning skills, academic confidence, and school-related challenges. Dyslexia and Dysgraphia Intervention Program. This supports children with reading and writing difficulties through targeted intervention that builds stronger literacy and written expression skills. Summer Intensive Program. During school breaks, our Summer Intensive Program offers focused support to help children continue progressing in key developmental and academic areas. Phonics Boot Camp. And through our Phonics Boot Camp, children can strengthen foundational reading skills by building confidence in sounds, letters, decoding, and early literacy. Parent and caregiver empowerment. At TDCC, we believe that empowering families is an essential part of every child's progress. Caregiver training. Our caregiver training equips parents and caregivers with practical tools and strategies to better support a child's development in everyday routines. Empower Me Program. Through our Empower Me program, families receive knowledge, guidance, and hands-on support tailored to their child's unique needs.